Um, the fact that they give you energy to exercise, to move, to lose weight, to give you better sleep. It makes you thirsty. Some of these patches do make you thirsty, so it increases your water intake. And this we already know that hydration, oxygenation, activity, keeping your weight down, improving your diet is the key to a good cardiovascular health. Cardiologist, as Dr. Stacy said, for about 40 years. I was an interventional cardiologist, and for the last 5 years, I became a clinical cardiologist. I'm very proud of it. I love what I do, and I live for my patients and the health of my patients. And I was introduced to the LifeWave patches about a little bit over 4 months ago, and it was a life-changing experience for me. And the first thing I thought about was about the health of my patients and what I could do to improve my patients. That was my first thought. I really didn't know much about the patches when I was introduced to them, but I knew what they did for me, and I knew that I would be able to help a lot of patients with that. I have been in Charlotte County now for about 36 years, and I'm still going strong, and I hope to be around for a long time. And I'm already helping a lot of my patients with the patch technology. The incredible mind of David Smith that created the technology. I mean, this is something very revolutionary and is genius invention. I think to be able to come up with a very simple way how to reflect your own energy, infrared lights, electromagnetic energy back into your body at different frequencies that affect different organs and chemicals in your body is something incredible. It's like futuristic. Mm-hmm. So, and this is not delivering any medicines to your body, to your system. So that's the number one thing that I want to say is this is just an incredible technology, and it does work. We have those four patches that Dr. Stacy mentioned. I think they all complement each other, but I usually start with the X39 patches. And believe it or not, most of my patients that come to a cardiology office, most of their symptoms are musculoskeletal, believe it or not. A lot of them also complain of tiredness, of fatigue, of not being able to breathe well, etc. But we know that the patches, the X39, improves, gives you vitality, energy, activates the stem cells. So the X49 as well. The Aeon patches regulates your autonomic nervous system, where the parasympathetic and the sympathetic system become more in tune with, more balanced with one another, so it can regulate your heart rate and other systems. These patches also lower your fibrinogen levels, also decreasing the viscosity of the blood, the thickness of the blood, and making you less prone to having heart attacks and strokes. That's an impressive quality of the Aeon patch. I think a lot of the benefit of the Aeon patch and even the X39, because the difference between the Aeon and the X39 is just one amino acid in the structure of the peptide of the protein. I'm sorry. The only thing is that the X39 is accompanied by a copper molecule. Mm-hmm. So they're very similar. So there's some cross effect between the Aeon and the X39 and the X49. So I think they all complement each other very nicely. The fact that they give you energy to exercise, to move, to lose weight, to give you better sleep. It makes you thirsty. Some of these patches do make you thirsty, so it increases your water intake. And this we already know that hydration, oxygenation, activity, keeping your weight down, improving your diet is the key to a good cardiovascular health. I mean, we cannot do anything, no matter what medicine you use or what method you use of treating cardiac patients. If you don't follow rules, you will not be. I cannot be successful, and nobody will be successful. So this is a partnership between providers and patients. And as I said, the partnership needs to work. It needs to work both ways. So I think the patches have become an incredible complement. There's a lot that I need to learn. There's a lot of experience that I need to gain in my practice with my patients. But so far, the experience has been incredible. I have patients who have Parkinson's and neurological disorders. I'm already helping them. The cognitive improvement in patients has been incredible as well. Their activity level, their strength, their optimism, the less pain, the being more up and not depressed. It's just incredible. It's an incredible array of symptoms that basically has to do with what each individual experiences, because we are all different. We cannot expect to have the same response on everybody. But I can tell you that just about 95 or 99% of the patients do have more energy. They sleep better. They feel better. They can exercise. I have a patient with dementia that I saw today who's now riding the bicycle. He looks, I see him just about every couple of months. He looks better now than ever. So the patches work. I think it's a wonderful complement to the therapy, and there's a lot more that we are going to find out about the patches in the future as we use them more in cardiology. The carnosine patch is a great patch, not only to increase longevity and improve, lengthen the telomere and hopefully make us younger, but also improves brain function and cardiac function and cardiac performance. So I think that's another complement that we can use with the X39. So it all depends. We need to tailor all these different patches to what we're treating or what we want to accomplish. But I would certainly start with the X39. Like I tell all my patients, let's try 3 months of the X39, and let's see in 3 months what it is that we need to tailor to your particular needs. Is it cognitive problem? Is it more less pain, and is it more endurance? What is it? And then we will go from there. But I would definitely start with the X39. I think it's an incredible technology, it's an incredible formula. That would be my patch of preference to start with.
If they're on blood thinners or other heart medications, and obviously we cannot give medical advice, you all know that. And so just as a general, if you're on any medications, what would you say to someone using the X39?
For example, the question about the blood thinners, I have not seen a change in patients who are taking blood thinners with the X39 patch, not at all. I have given the patches to patients who have had major cardiac surgery, bypass surgery, aortic root replacements, aortic valve replacements, and they're all doing great with the patches. They right now they're regular subscribers to it, and they believe in it. And knock on wood, I have not had any major problem with anybody. Remember, fibrinogen levels goes up as an inflammatory reaction to the body. So going back again to the basics, and the basics are be healthy, do what you need to do for yourself. Diabetes, hypertension, obesity, lack of exercise, poor hydration, not sleeping well, lack of oxygen, lack of fresh air, all that can be inflammatory. And I think if we reduce our own personal inflammation, there's no major reason, unless there's a genetic problem where the fibrinogen levels would be high. We need to correct blood pressure. We need to be tight on the diabetes, improve the diet, lose weight. Come on, we have an obesity problem in this country. We have a food problem in this country, and we need to be health conscious. I practice what I preach. I keep myself on a regular exercise program and eat the right things as much as I can. Am I 100%? No, I like to have fun every once in a while. I mean, it's like these patches have turned my life around. I mean, we're starting from lumbar radiculopathy to left hip osteoarthritis to cervical spine disc problems to carpal tunnel, to plantar fasciitis, GERD, and it's all went away. It all went away 90% from day one. A couple of more things that have been stated in some of the testimonials in all the different podcasts is I have been gray, God knows for how long. Believe it or not, my hair is starting to turn black again. I cannot believe it. I mean, I have black hair coming out. It's incredible. I've had a problem with receding hairline. I mean, receding gum line for the longest time, which I think may be traumatic, could be also genetic stuff. My gums are growing back again. I mean, there have been testimonials, including by one of our senior presidents in the company, that she was the one who stated that she had regrowth of her gum line. Well, it's happening to me.
Wow.
So it's like what I tell the patients is, you know something, try the patch. I'm not going to tell you all the benefits that you might get out of it. Try it for 3 months. Tell me at the end of 3 months, besides from all the things that I think is going to do for you, tell me what else you notice that all the benefits that you are deriving from it.
Fantastic. Well, they want to know what patches you're using.
Well, I regularly I use the X39, the X49. I use the Aeon patch. I use the carnosine patch. I use the glutathione either every day or every other day, depending on what I'm doing, and that's basically it.
So, post ischemic stroke, Dr. Mario, do you want to talk about the stroke?
Sure. So that's a very good question, and it's kind of hard to say exactly. If I had to say which patches I would use for ischemic stroke, I certainly would say X39 and carnosine would be the go-to patches here.
Okay.
I think between the autonomic nervous regulation, the regeneration, eliminating oxidative stress in the cells of the brain, I think could help to regenerate a lot of those partially damaged cells. I'm not sure about the total regeneration of the cells that have been damaged, which goes about the same way for the heart. I think that is something that that only time will tell as we dive into these subjects in the future. But I think that for ischemic stroke, the same thing as Parkinson's, I think X39, carnosine, I do not see right off the bat or right from the beginning that they would interfere with any medicines that are presently given for that. As a matter of fact, patients with Parkinson's and patients with debilitating neurological disorders, I think would be helped by the benefits of the X39, giving them energy and muscle endurance and growth and all, and of course the brain function and the cognitive function. I think that would be very regenerative for all of them.
What about AFib when the heart is? What would you say to that if someone is dealing with that?
Well, I've heard some testimonials about patients that may have been in AFib and they have used 2 or 3 patches of 2 or 3 carnosine patches on the heart, and when they may have gone back to the regular rhythm. I have not tried myself that yet. Cardiac rhythms like AFib are chronic disorders, and I think we need to gather more information going forward, which is one of the things that I really would like to do as part of the Life Wave, to collect more clinical data on the use of the patches, on not only how the patients feel, but also getting other clinical benefits, and not only biological benefits, but also that get translated into more clinical benefits. But you know, I have already tried it in one patient recently. I'm waiting to review his heart monitor in the next few days, and I'll see if there was a positive balance with the carnosine patch. But I would love to collect more data, obviously, without a doubt.
We'll work on that.
I have an incredible population of atrial fibrillation patients in our county.
About clogged arteries, blocked arteries, buildup of plaque, arterial plaque, cholesterol, things like that. What would you say to that?
It's a good question. I think, again, a healthy lifestyle is probably the best that you can do. I think to keep your inflammatory markers down with exercise, good diet, control of diabetes, hypertension are key to accomplish that. I think the combination of patches that we've been talking about through regulation of the autonomic nervous system, endothelial function, clearing of improvement of atherosclerosis by improving the viscosity. I mean, Dr. Pam already talked about it, how you can improve if you improve the viscosity of the blood and the function of how the conductivity of the impulses and go between the organs, and that you can make it easier. There's a better chance of recovery, a better chance of improving overall vascular and cardiovascular health. So again, I'm telling you, it's a combination of factors. I don't think that I can tell you one particular a patch that will do that, but I think, again, X39, carnosine, Aeon, I think they all help and work with one another to improve cardiovascular health. I really do.
Perfect.
Lowering of the blood pressure, lowering the systemic vascular resistance, improving autonomic nervous system, improving your energy, so that allows you to exercise and be healthier.
Perfect.
Anyway.
And somebody is asking about ventricular standstills.
Well, that's a different problem, because ventricular standstill could happen as a result of multiple reasons. It could be as a result of a heart attack. You can have an acute heart attack and cause so much damage or lack of heart function that your conduction, your electrical wires completely be damaged, and your heart will stop conducting electricity. You can have a weak heart muscle that could happen as a result of multiple reasons, whether it's a virus or untreated hypertension or alcohol or chemotherapy drugs. And some of those patients can have a sudden cardiac death from multiple reasons. But cardiac standstill, I'm not really sure. I think it's a different problem, and I think we need to tackle the underlying problem first, because we can take care of ventricular standstill with a patch. We need to go, as Dr. Pam said, we need to go to the root of the problem. If there's a deficiency, we need to correct the deficiency.